Good morning. Today is November 19th, 2015, and today marks the first day of my chemo day treatment diary post. So I actually want to talk about yesterday, November 18th, 2015, the first day of chemo, meaning the day the chemo treatment's given. Needless to say, I was full of anxiety, afraid. I had to wait a long time to be called back, which was not great and did not help with the anxiety at all. I met with the pharmacist at the place that I go to, and she prescribed me two nausea preventive or nausea treatment prescriptions. And she explained them very well. She made me read out the directions, which I had never done before. No pharmacist had ever asked me to do that. But I kind of liked it. I was like, good, that's good. And so then I went back waiting. I met a nice gentleman there who, offered one of the things that worked for his wife. So that was helpful and sweet. Helpful with the nausea, yeah. And so then I went back, and I had invited two friends, two of my closest friends. They've been there through all of this since I first got diagnosed, been through every event with me, helped hear me complain, helped me, go through back and forth, like what's the right decision, and help me with my decision-making process in general. So they understand how I think, and I'm glad I brought these two, because I had a pity party moment over there. I actually broke down for a few minutes. Yeah, it's not easy. I saw a room full of people waiting. Can't tell who's going for infusions, who's going for, their treatment, who's here just to meet with the doctor. But it was overwhelming. And then you just feel bad. Like, I felt bad. Like, why me? And am I going to be able to handle it? Was the chemo going to be tough? Things like that have thoughts that have come up over and over and over, But these two friends of mine, they're amazing. They let me have my pity party. They gave me the comfort I needed. But then they also reminded me that I made this decision when I was rational, not when I was emotional. And I based it on logic. I based it on reasoning and research. And so it's good to have people like that. And I encourage, if this ever happens to any of you, which I hope it never does, but if it does, or any type of situation of health-related issues, take someone who understands you. And because I was begging at one point, please just take me home. I don't want to do this. Please. It was pretty bad. I haven't had a moment like that for a while. I mean, even before my surgery, I cried, but I prayed, and I felt good. In the morning time, I was so upbeat, and I felt great about my surgery. This, I didn't have that same feeling. I was, oh my gosh. But I think there's a little bit more of fear here for me. I am so not into medicine. I do not like medicine. I do not take medication. I rarely would take an Advil or Tylenol. And all of a sudden, here I am, I'm going to be treated with so much medication. It was unbelievable to me. But having said that, based on the stuff I saw in research, based on the kind of lifestyle I know I want to live, and the best chance for me, and knowing how aggressive my cancer, that's most important, how aggressive my cancer is capable of being, and the studies I've seen, I don't think chemo was not an option. For me, chemo is very much an option, very much mandatory. So I went with it, and I'm glad I went with those friends who made sure I didn't back out like a little scaredy cat. And I went through, and the blood work was probably the hardest part of it, which was not even a challenge. They just drew my blood, and I went, ow, and it was okay. I found out that I have to do it every time I come in, once every 2 weeks, maybe 3 weeks if my body can't handle the 2 weeks. I have to get blood work drawn. I wish there was a better way. I don't like needles. I don't like being injected. But that's okay. It wasn't too bad. Got my blood work done. Went to the back, and the back room was the hardest other part. It's hardest mentally and emotionally because you walk in and you're not expecting. I didn't expect what I saw because, when I was looking online, no one talked about this. I approached a room that was full of recliner chairs. Although they're recliners, they're nice, but they're still there with people lined up after lined up after lined up, chair after chair after chair, getting their treatment. And it just took me back to something like the influenza epidemic, where you see people lined up, and it didn't fare well. And they reminded me of stuff that I read and saw in videos and movies and read in journals and books. I got scared. It was overwhelming, to say the least. It was shocking. And so then we were taken into a room for the education part, and my friends were with me in that. And, we learned a little. Nothing new. Same stuff the oncologist told me. But I got to share it with my friends, so that was great. The best part of that was the nurse who came in. She had a great personality, great spirit, very uplifting, caring nature. And so I liked her a lot. And she told me of some, we went over the film and I interjected with so many questions. And then she told me about things like what to expect and when to expect it. Usually day 3 is the time, day 3, day 4. How to handle the nausea, other things to look out for. And she kind of gave over-the-counter recommendations that she's seen in her experience have helped some of her other patients. Multivitamins and supplements that could help. Although there's no clinical tests on these or clinical studies that these are really that helpful, just based on her experience, because I inquired. And I appreciated that because, these are the people who see the patients every 2 weeks, every 3 weeks, and hear them open up and talk, about their experiences. So I really did appreciate that. And she made me feel comfortable. I told her I'm scared of needles. And she said not to worry. She was scared of needles, and then she became a nurse. But she said that this does not hurt at all. I got a port inside of me, and how the injection into the port does not hurt. So I didn't believe her. But when I went there and they got seated and they started the process, I turned around, looked at my friend. Then the next thing I know, she told me, exhale, inhale. And she stuck me, and I felt nothing. So that was it. And then before the chemo treatment, they gave me 2 types of nausea treatment. Drugs. One was put through for 20 minutes, one was for 30 minutes. Then the chemo started, which was about an hour, maybe a little over an hour. And then something called another chemo drug, which is referred to infamously as the Red Devil. And the Red Devil was pushed through me for 10 minutes. Now, for the first chemo drug, I only felt like a little lightheadedness, and I took my, I had little snacks to chew on. And then for the Red Devil, they told me I would have pressure, sinus pressure, and all this stuff. And I didn't really have it at that time. I was fine. So when I left, I happened to have joint pain in my right knee. Not immediately. This is like, I went to a meeting, and after my meeting, I had joint pain in my right knee. Then throughout the night, it progressed to my ankle, right ankle. I had nausea that started. I felt in the pit of my stomach. Nothing major. Just kind of knew something was happening. And I had this headache, and I felt like it was more like a migraine. Like, the headache with the nausea. but like a light, low grade migraine. Or kind of like how I felt during my pregnancy. That's how I kind of think about my my nausea, that it's going to be similar to pregnancy. And I was, with both pregnancies of Zoel and Zaria, I was morning sickness, morning and night, like 24 hours. So I don't think it's going to be too big of a problem. But so that's my experience from the first day of chemo. And in just a little bit, I'll tell you about my second day of chemo morning. Okay. Thanks for your support and thanks for your concern. Take care. Hope you guys have a great day. Bye.